Radiology in a Minute. I'm Sid Dogra, an Associate Editor of Radiology in Training. Today I'm discussing an important new paper, a multicenter study on assessment of non-mass lesions detected with screening breast ultrasound by Su-Min Ha et al. Of course, most breast screening is performed using mammography, but there has been increasing interest in the last few years in using screening ultrasound for patients with dense breasts, as increased breast density decreases sensitivity for mammographic findings. In diagnostic ultrasounds, we already frequently encounter non-mass lesions, which are areas of altered echotexture compared to surrounding tissue that lack three-dimensionality of masses. As breast ultrasound screening increases, presumably we will encounter more NMLs. Consequently, there's a need to gather data on the predictive value of imaging features of NMLs for diagnosing malignancy in screening ultrasound. This study analyzes which features are associated with malignancy while taking into account the presence or absence of mammography correlates. The study used retrospective data from 3 centers. The authors included asymptomatic women who underwent screening ultrasounds and had NMLs detected, had a final diagnosis either via tissue sampling or stability on 2-year follow-up, and had a mammogram within 3 months of the ultrasound. Exclusion criteria were lack of mammography, insufficient follow-up, no final diagnosis, and interventions within 2 years that precluded lesion assessment. 3 radiologists identified the NMLs in consensus, and a separate group of 3 radiologists recorded several features, including size, echogenicity, distribution, certain ultrasound features, and certain mammogram features. Ultimately, 993 NMLs from 993 women were analyzed, 914 were benign, while 79 were confirmed to be malignant on surgery. On multivariable analysis, multiple ultrasound features were correlated with malignant NMLs. Associated calcifications had the highest odds ratio at 22.9 for malignancy, followed by posterior shadowing, segmental distribution, mixed echogenicity, and finally size. Unsurprisingly, these features had higher positive predictive value in patients who also had abnormal mammogram findings. Segmental distribution was the only ultrasound feature associated with malignant NMLs in both the positive and negative mammogram groups. Notably, there was high agreement between 3 readers for ultrasound features. So what are the main takeaways? Even on screening ultrasound, certain features of non-mass lesions suggest higher risk of malignancy, but the predictive value depends on whether or not there are mammogram abnormalities. Both modalities are thus required to guide management.